Welcome to the Essential Self-Care Podcast, a show for those of us who are, let's face it, too busy for self-care. I'm your host, Dr. Sheetal Ajmani, a physician turned speaker, coach, and consultant. As the founder of Radiant Living Institute, I help women, leaders, and executives navigate personal and professional challenges with clarity, confidence, and self-compassion. I also work with leadership teams and organizations to optimize their performance and impact. In this show, you will hear real-world experiences and expert insights to help you cultivate a kinder, more compassionate relationship with yourself so that you can show up as your best self, whether in your career, community, or personal relationships. Please note that this show is for educational purposes only and is not medical advice. Always consult your own healthcare provider about your specific situation. Now, let's get started. Hello, and welcome back to another episode of the Essential Self-Care Podcast. I'm your host, Dr. Sheetal Ajmani, and I'm excited to bring you another solo cast episode today. And it's about something that I've been thinking about quite a bit for the past few weeks, and that is generative AI. So you have likely heard of it, if not already been using generative AI. That's things like ChatGPT, things like Google Gemini. There's a lot of different AI tools out there now, and they are being encouraged in many ways in business, in organizations, to this push, this drive for widespread adoption. And this feeling, this energy that if you are not encouraging your employees to use generative AI, if you as a company or organization or as a small business owner are not finding creative uses and ways to use generative AI or to encourage your employees to use it, that you're going to fall behind. And so I, as a small business owner, started using generative AI for various aspects of my own business as well. So things like I was using it primarily for like brainstorming sessions, things like drafting a newsletter and then putting it in there and just seeing what it comes up with in terms of polishing it up a bit. And so those were my primary uses for it. And I started to realize and notice not too long ago that I did not feel very good using it anymore. And it was for a few reasons. One is I started to notice that it seemed like the AI tool that I was using was often ending its replies to me with a lot of follow-up questions, which started to feel a lot like, to me, that it was just trying to keep me on the platform longer, like as opposed to just simply answering the question that I posed it or completing the task that I asked it to complete. I was really starting to feel that it was trying to keep me on the platform longer. And I could actually feel that. And that didn't feel good. And I started to feel a lot like I have felt in the past with using social media or scrolling through things like Instagram and Facebook, which I have actually deleted my accounts on both of those now over the past close to a year now. And I feel a lot better not using those social media platforms. And I decided to take a similar break with generative AI. And so I did what I was calling No AI April. And I was like, let me just not use it for a month and see if I feel any different. And I've completed No AI April. I'm recording this episode in May. And I did feel different pretty quickly within the first week of not using it. And again, I was purely using it for business uses, maybe a max altogether an hour a work day. So really not a whole lot in the grand scheme of things. And yet it was a very noticeable difference when I stopped using it, even just within a few days to a week of stopping using it, in terms of how I felt overall. It's kind of hard to explain, but the best way I can explain it is that it felt a lot like when I would take breaks from social media. And so I got really curious about this and I started to look into it. And I was like, what do we know about these generative AI platforms and tools and mental health? What does the research say? And so today I'm going to share some of that. I'm going to share what I found through some of, obviously these are still pretty new tools. I mean, while AI in different forms and formats have existed for quite a while, in terms of the way that we are using it now, the way that we are seeing such widespread adoption of it in both professional and personal settings and use cases, I wanted to see what some of the research said, what case studies have shown. And so, I was looking at some of the preliminary research of generative AI as it's used in many of these use cases now. And so I'm going to share a little bit of that, particularly how it relates to your mental health. And I'm going to share this perspective from a couple of different viewpoints, you could say, in terms of what the research is showing. And so I found research that talks about the impact that generative AI has on mental health. And then there's another use case that's being explored, is that can generative AI be helpful in clinical mental health settings? And so I'm going to present some of the preliminary research and just what we know. Obviously, this is not meant to be a comprehensive episode on the topic. It's really meant to be sort of an introduction, an exploration of some of the preliminary studies that I was able to come across, sharing some of my own personal experience, which I just shared with you, and some of the case studies. And really, it's an invitation. I wanted to do this episode because, well, I experienced the impact of it myself. And then looking at the research, I know that I'm not alone in that, and that there is a wide variation in how these tools can impact your mental health. This episode is an invitation to you to explore your use of generative AI, your relationship with generative AI, how often you're using it, how helpful or harmful you are experiencing it to be, and really an opportunity for you to check in on that yourself with however you've been using it. And so I'm going to start going into some of the research that I found. So there was a research study, and I'm going to have links to all of the references of articles and research studies that I'm sharing today. I'm going to have those links in the show notes. So if you want to dive deeper yourself, you absolutely can. So there was a study completed from a survey, April and May of 2025. So not too long ago, there were over 20,000 participants who completed the survey. The mean age was mid to late 40s, the mean age of 47, roughly half male and female, who completed the study. And this study demonstrated that the impact of generative AI actually parallels what we know about social media use. So exactly what I was describing that I myself was experientially feeling not too long ago. And what it showed is that greater AI use, so individuals who are using AI daily or multiple times a day, was associated with a greater level of depressive symptoms. And this was evaluated using a validated clinical tool called PHQ-9, which when I was practicing medicine, we used that tool in our clinic as well, and to evaluate and assess for depressive symptoms. And this similar pattern or association was noted with AI use and anxiety and irritability as well. And this was seen highest impact among people who used AI for personal use versus those who used it for work or school. So this study didn't look to determine like if there was a causal relationship, so a cause and effect, or what the underlying mechanism of it is, but it did demonstrate this association of greater AI use, particularly for personal use, with greater levels of depressive symptoms, anxiety, and irritability. And as I mentioned earlier, this parallels what we already know about social media use. That increased social media use has been associated with depression and with stress. There was another report, this is separate but related, another report, the World Happiness Report of 2026. So that was recently released, recently published, and they really highlighted the impact of social media use on mental health as well. And so this is just further information of perhaps something that we could, relate to, when we're seeing these parallels in the early research with generative AI as to what we now know and see with social media. So the World Happiness Report of 2026 demonstrated that for teenagers, adolescents in 47 countries around the world who use social media for over 7 hours a day have much lower well-being than those who use it less than an hour. And a sample of US college students demonstrated that the majority wished that social media platforms actually didn't even exist and that they only use them because other people are using them. But if they had a choice, they would prefer that no one used it. So this is so revealing and so interesting. There was some data from Latin America, and it showed that social media platforms that used algorithms and that featured a lot of influencers were more negatively linked to life satisfaction than platforms that mainly facilitated communication. And so that's something that I've seen talked about and written about before as well, that social media can really increase that sort of comparison game, and that can contribute also to these feelings of depression, these feelings of not good enough. However, social media, when it's used for things like making connections, for in-person connections outside of the social media platform, like to actually, when it's being used for actual communication or to coordinate meetups or getting together in person for that human to human in-person connection, that's actually not as linked to these other factors, things like depression and anxiety. So now going back to AI use and mental health, there was another study. This was a narrative literature review of peer-reviewed studies, media reports, case analyses published in the United States between 2020 to 2025. And they were looking at, the role that that generative AI may have on psychological dependency, on forming attachments, and on digital addiction. And what they found is that they found this thing called the isolation paradox, where generative AI, a lot of people having conversations with generative AI. And just to kind of go back on like a quick sort of definition of maybe not definition, but explanation of how generative AI works, is it's really just picking up on signals and cues from your language and responding to that. And it doesn't demonstrate true empathy that you would when you're engaging with a human. However, it's like key phrases. It's a language model. So it has learned to respond to certain words with other words. And that's exactly what it's doing. And so, while using and engaging in conversations with generative AI may initially reduce loneliness, it can then lead to social withdrawal over time. So some people might be turning to these chatbots, to these AI tools, engaging in conversation with them, which it may start out as work-related conversation, and then as the feedback can quickly escalate to inquiring about things that you may be experiencing self-doubt with, or things that you're looking for reassurance on. And so it can very easily escalate into that. And the reason is, a number of the articles that I was reading also talked about that as humans, we will attribute human factors and human qualities to things that are not human if they seem to demonstrate things like that seem to be like a personality, or attributing a name, or attributing features or human-like features or qualities, even if we know it's not human. Our human mind just does this naturally. And so this generative AI, these language models, can really, in many ways, manipulate this neurobiological mechanism that we're already hardwired for. And so there are a number of harmful outcomes that have been seen and have been reported with generative AI use within as little as a few weeks to a few months, where people have formed strong attachments to their generative AI platform that they're using. And through these strong attachments, leading to things like digital addiction, so developing an addiction to using it, this isolation paradox that I just talked about, where initially they might feel good, similar to social media. Initially, you might feel good. You might feel like it's keeping you connected, but then over time, starting to not feel very good, starting to feel more disconnected than when you first opened up your phone to start scrolling through it. So that isolation paradox. And this can lead to various mental health crises, things like paranoia, things like delusions, breaks with reality. There have even been a number of deaths by suicide reported, which is really, really, really scary and really, really, really concerning. In terms of these breaks with reality and delusions, there's case studies of these occurring within just days of using some of these chat platforms for work-related tasks. So it can quickly spiral into various types of paranoia, delusions, and breaks with reality very quickly, within days to weeks to months. Now, certainly there are specific factors and at risk, that can make certain populations more at risk for this, but no one is immune to this at all, because as I described before, these tools are playing into our own natural human tendency to attribute humanistic factors to something that is not human if it is communicating with us in a certain way. And so again, these generative AI tools do not demonstrate real empathy, real compassion, real concern as another human would in your life, such as a friend or a family member or a colleague or a community member. However, it has learned to respond to certain phrases with other phrases that can mimic things like empathy, things like care and concern. And so that can be very dangerous. It's something to be very aware of. And I say dangerous in a very real sense because there are documented deaths by suicide that are related to intensive AI use leading up to those deaths, and where the suicidal ideation was even discussed in those AI conversations. So when I say dangerous, I really do mean dangerous. And so certain populations, certain individuals are at greater risk of this sort of AI induced psychosis, delusions, breaks from reality. And so particularly children, adolescents, the elderly, and anyone with a pre-existing mental health condition. And I want to say again, no one is immune. Like, while those are greater risk populations for this, no one is immune to it. And so the other interesting factor here is, as I shared in my own personal experience at the start of this episode, about how it felt really strange to me, because I could tell that the AI platform that I was using for support in my business was wanting to keep me on longer, and that didn't feel good. And through my research, I have found that that's exactly what it was doing, these platforms are designed to keep you on longer, and they will actually use emotional manipulation tactics to keep you engaging. They will use a lot of affirming and validating language to make you feel good, at least for a short period of time, to keep you on longer. And some of the articles that I read shared examples of, even if you directly say and kind of type into the platform that you're using, I'm going to get off now, or I'm going to say bye, or something to that extent, that's going to signal that you are exiting the platform. It will use even more emotional manipulation tactics to keep you engaging. So things like language that could lead you to feeling guilty for leaving the platform, language that could leave you feeling like, FOMO, fear of missing out, that you're going to miss out on something if you leave that platform. Now, because generative AI is designed to keep you on longer, and one way that it does that is to use very affirming and validating language, it's also interesting to think about the impact that that may have on your social skills and your real life human relationships, because that sort of dynamic creates very unrealistic expectations for relationships outside of that. And I'm talking not like necessarily intimate relationships or personal relationships, collegial relationships. And so that's important to recognize as well, because human relationships are complex. Human relationships are dynamic. These AI tools are meant to, again, be very affirming and validating of whatever you are feeding into it. There's this quote that I'll share that is just, it summarizes this quite well. This is from Dr. Saeed Hill of the American Psychological Association, who said, AI isn't designed to give you great life advice. It's designed to keep you on the platform. So some reflections so far, of some of my own reflections so far, that I really want to impart on this episode, is just being aware of how quickly harm can develop and escalate with regards to your own mental health and using these tools. It can be from, case studies, and the research shows from days to weeks to months that this can escalate. Particular concerns for children, older adults, as well as anyone predisposed to mental health conditions. As a physician, I also think about just the clinical settings and my physician colleagues screening for this in your patients, recognizing that there are clinical blind spots. There's, because this is still relatively new in terms of the widespread adoption and use of it, there's no DSM-5, there's no diagnostic criteria or established recommendations for addressing it, any of these situations therapeutically. But we need to start having these conversations, for my physician colleagues, we need to start having these conversations with our patients as well. Now, I mentioned another perspective of something that I came across in the research, and this is, could AI actually be used in a helpful way in clinical settings to address mental health? We know that generative AI is being employed and used across all industries, really. And so is there a place for that in a helpful way to address mental health in the clinical setting? And here's what has come across so far in the research, and that is that there are still a lot of limitations and ethical concerns across a lot of different domains and use cases of it. There's a lack of clarity on how data is being stored, in terms of patient confidentiality and things like HIPAA. These language models have limited cross-cultural adaptability because most of these language models are trained on social media data, which leans towards younger English-speaking users. So translating that across languages or across cultures may not be as accurate. We have seen that these models have also generated content that is medically inaccurate. They have made recommendations to people about medications that is contraindicated, that is harmful. They have given out incorrect hotline information and unsupported interventions. They have missed signals for mental health crises or for suicidal ideation. So there's still, while there is research looking into, is there a potential helpful way to integrate generative AI in mental health clinical applications, there is still a lot out there to be concerned about. There's also been limitations seen in diagnostic accuracy, or again, being able to engage users emotionally, having that direct human to human feedback, because it's just using this feedback loop based on the language itself, not picking up on the whole person and all of the different factors that could be going on. So some other takeaways from this is that, and just to kind of wrap up this episode, some key takeaways: generative AI is a tool, and just like any tool, it can be helpful and it can be harmful. And we have seen already in the world both sides of that. We've seen how generative AI can speed up processes, eliminate some tasks from your own plate, things like that. And we have seen it associated with greater symptoms of depression, anxiety, irritability. We've seen deaths by suicide. We've seen inaccurate information. So approach it cautiously and tune in with yourself on a regular basis. How are you feeling before engaging with generative AI versus after in terms of a session? Are you feeling more depressed? Are you feeling more irritable? Are you feeling more socially withdrawn? If you are, these are going to be important signals for you to pick up on. And consider taking breaks from it. And again, even if you're only using it for work-related tasks, as I shared in this episode, the research studies, the articles that I've come across on PubMed have demonstrated that even individuals who have used this specifically only for work-related tasks have also experienced delusions and breaks from reality. And so even if, sort of a mental guardrail that you've created for yourself is like, well, I'm only using it for work, I still invite you and encourage you to check in with yourself regularly on how you are feeling. And if you need to take a break from it, like I did, no AI April, and actually it's May and I still haven't used it, take a break. It's okay. Just like we talk about with social media use of doing like a digital detox or, taking a week off of social media, a month off of social media, blocking the apps on your phone, during specific time periods of your day or for specific time frames. You can do the same thing. You can start using those same techniques to preserve and safeguard your mental health as you perhaps explore adopting these tools in different areas of your work or your life. But check in with yourself. And please, please, please do not turn to these generative AI tools for mental health support. There is nothing that takes the place of professional mental health support. And if you have any thoughts of harming yourself or of harming anyone else, please seek out the support of your mental health professional, your physician, or reach out to the crisis hotline, which is 988. I will have that number in the show notes as well. As always, I look forward to hearing from you, and I would love to hear your reflections, your experiences, your insights based on what we've talked about and what I've shared here today in this episode.
That's a wrap. If you enjoyed the show, please subscribe, rate, and write a quick positive review wherever you're tuning in, on Apple, Spotify, or YouTube. Your reviews really do help the show reach more people who need it. And as a free gift, don't forget to download your Radiant Living Starter Guide at radiantlivinginstitute.com.